More than 11,000 people in this country are known to have the virus, and more than 160 people have died. Nearly half of them were in long-term care and retirement homes. Quebec reported the biggest spike today, 907 new cases there. The number of infections is also rising everywhere. Those numbers do not include all the people who have not been tested yet or who are still waiting for test results. Many countries, including the U.S. and the U.K., have released infectious disease models they are using to plan for the impact of this virus. The models give projections of different scenarios, best case and worst case. Prime Minister Justin Trudeau says he knows Canadians want to see those numbers and predictions, and that, he said today, will happen soon. Ontario's Premier went a step further today. Doug Ford says he'll release Ontario's models tomorrow, and he says there'll be a wake-up call.
The situation is extremely, extremely serious. You deserve to see the same data that I see when I'm making decisions. You deserve to know what I know when you're making decisions for yourself, your family, and your community.
We don't need projections to know what's already happened in other countries. Canadian hospitals are preparing for a surge like we've seen in Italy, Spain, and the United States. Healthcare workers we know have been raising the alarm about shortages of personal protective equipment, masks, gloves, and gowns. Tonight, the Canadian Medical Association has a stark new picture of how badly that is all needed. The CMA surveyed 5,000 doctors this week. More than a third in offices and walk-in clinics say they'll run out of N95 masks, face shields, and goggles within 2 days or less. In some cases, they've already run out. Physicians in hospital settings aren't sure how long their supplies will last. Many say they're already being asked to ration supplies. Federal officials say more supplies are on the way and production in Canada is being ramped up. The health minister did admit the disease models, even the best case scenarios, show that our healthcare system will be overwhelmed.
Ultimately, at the end of the day, our health system cannot cope with the surge. It was never designed to see that many critical patients all at once, nor would any system around the world be designed, as we have seen from countries all around the world try to get ready for this surge.
Mercedes Stevenson is with me from Ottawa. Mercedes, getting personal protective equipment is a matter of life and death for doctors and nurses. What's the latest on what is coming and when it will arrive?
Well, Donna, help is on the way, but the question is whether it will make it to the front lines fast enough. These are the most recent stats that we have from the Government of Canada. I got them just before we went to air. So far, 10 million masks have arrived this week. Another 1.1 million arrived overnight. Those are all surgical masks, though, not the N95 kinds with the ventilator on them. Now, staff are going through these masks, I'm told, 24 hours a day to vet them and get them out. 174 ventilators have now gone out to the provinces, and there's more coming in. But to give you a sense of the overall numbers, Donna, there's 157 million surgical masks yet to come, 60.9 million of those N95s that haven't shown up yet, and about 4,000 ventilators. Now, doctors and nurses on the front lines are saying they need this desperately now. Take a listen to what the Canadian Medical Association had to say.
We really feel that we're at a crisis point, and it's causing physicians, nurses, and other healthcare workers on the front line immense anxiety and additional stress that they don't need right now.
Now, Donna, the federal government says that the provinces all have orders in as well. But on this call tonight with the premiers, this is one of the things they're going to be discussing, is who is in the most urgent need and starting to move those supplies as quickly as possible.
Okay, Mercedes, let's talk about the disease models. Ontario's Premier says he's going to release that province's disease models tomorrow. He says people deserve to see the same projections that he is seeing. The Prime Minister said last week the federal public health models would be released too, but they haven't been. Do we know why not?
Well, Donna, so far the Prime Minister says that they have concerns about accuracy and they're trying to make sure that the models reflect reality. Take a listen to what he said to reporters earlier today.
We're coordinating with the provinces to make sure that the data is consistent right across the country. And that is the numbers that we are putting through into various models. And as we get those models more accurate, we look forward to sharing them with Canadians.
The federal government is under increasing pressure to release their modelling. Part of that means they have to get the modelling from the provinces, all of whom have been doing this differently. But experts say releasing these models could help with behaviour, Donna, if people see how bad things could get.
All right, Mercedes Stevenson in Ottawa, thanks. There's some relief tonight for hundreds of Canadians stranded on board 2 cruise ships off the coast of Florida. The ships have been granted permission to dock at Port Everglades. And Global News has confirmed nearly 250 passengers are scheduled to fly to Toronto tomorrow morning. The cruise ships, one of which has confirmed cases of COVID-19 on board, have been desperate to find a port for weeks. Mike Drolet explains what happens next.
The early morning Florida haze turned into midday clarity for 250 Canadians living in isolation on a pair of Holland America cruise ships, including Michelle Perron's 75-year-old mother, Jocelyn.
She's elated. There's a plan. She's got a piece of paper with a plan. And this is the first time in over a week that they've had any kind of direction in terms of what was happening.
After 27 days at sea, they've finally been given the green light to come home.
My understanding is they will be flown home on a charter flight.
The Canadians are among 2,500 passengers and crew that were supposed to disembark in Chile on March 21st. But after 4 people died and another 233 showed flu-like symptoms aboard the Zaandam, Chile closed its ports, and the passengers were forced to isolate.
We have cabin fever. Boy, if you want a definition of cabin fever, this is it.
2/3 of the passengers were transferred to a second ship, the Rotterdam, and both tried to dock in Florida, only to be turned away.
We have enough to deal with our folks in Florida.
The reaction was overwhelming. Come From Away trended on Twitter, reminding Florida's governor how Canadians welcome stranded Americans after 9/11. The sequel to Come From Away is going to really suck, read one. And facing political pressure from the left,
we Americans don't turn people away,
and the right, Florida's governor relented, although only Florida residents can stay. And that's perfectly fine for Canadians like Chris Joyner.
So it was, like, for me, a trip of a lifetime. But it's turned out to be a nightmare of a lifetime.
They'll have to isolate when they return, but at least they're no longer lost at sea. Mike Drolet, Global News, Toronto.
The U.S. now has more than 240,000 confirmed cases of COVID-19, and more than 5,700 people have died. The economic toll is becoming more and more clear. In the last week, 6.6 million people filed unemployment claims. In the span of 2 weeks, 10 million jobs have disappeared. Jackson Prosco has a status report on where America is at right now.
In cities across the U.S., they're preparing for what's to come. New field hospitals are under construction in convention centers and stadiums in every corner of the country. Everyone fears they'll be the next New York, where hundreds of new deaths were reported overnight. It's so bad, paramedics have been told not to transport unresponsive patients to the hospital if they can't be revived in the field. Medical supplies are now critically low.
We have about 6 days of ventilators in our stockpile.
Get me pads and a board now.
Hospitals everywhere face the same shortages. The U.S. national stockpile is critically low, too. States say the thousands of ventilators on order will arrive too late. There's little sympathy from Washington, where President Trump tweeted a message to governors and hospitals. We are a backup for them. The complainers should have been stocked up and ready long before this crisis hit.
What do you see as the greatest failure of the U.S. response?
We spoke with Jeremy Konyndyk, an expert in pandemic preparedness.
I think the greatest failure, and it's really the failure that everything else derives from, was the failure to take this seriously in late January.
Today, the U.S. is bracing for a predicted 100,000 to 240,000 coronavirus deaths. That best-case scenario may not be achievable. Some states are only now implementing stay-at-home orders, having waited until their case numbers and fatalities started to climb.
If anything, it's possible that we may see more cases than those models project. Obviously, I hope we don't. But what's clear is there are a lot of parts of this country that are on a similar trajectory to New York.
In a sign of how rapidly things are now changing in the U.S., public health officials are broadly recommending that Americans cover their faces when they're out in public. They say a scarf or a homemade mask is all that it could take to slow the spread of coronavirus. At this point, they do not want people wearing surgical or medical grade masks because they're in such short supply. Donna?
Jackson Prosco in Washington, thanks. In this country, nearly 60,000 of Canada's 68,000 troops are now in self-isolation, not because they're sick, but to keep them ready. General Jonathan Vance tells Global News they'll be able to deploy across Canada if necessary to help with the pandemic. We are watching that outbreak at Pinecrest Nursing Home in Ontario. 2 more residents have now died. 16 people in the home have now passed away from COVID-19, plus the wife of one resident. More than 24 staff members are also infected. The outbreak was made public in mid-March at the 65-bed facility, and the local health unit says it is the largest outbreak in Ontario. But we're all being forced to find ways to cope during this pandemic, and it's taking a toll on our mental health. Today, Ontario's Premier announced he's investing $12 million into virtual mental health supports, programs such as Kids Help Phone and Bounce Back.
You're not alone. We're listening. We care. If you're struggling, please reach out. Talk to someone. If you know someone who may be struggling, talk to them. Pick up the phone.
The health minister in Newfoundland and Labrador is encouraging people to plan virtual gatherings over Easter. And he's also warning people about dating apps, which he says have seen increased use during this pandemic.
Let me warn you, if you use Tinder or Grindr and you swipe right, you might get more than you bargained for. So please be careful.
Newfoundland and Labrador is bracing for a surge in cases. There are 183 there now, most of them linked to funerals that took place at one St. John's funeral home. Canada's pandemic plan for prisons. Coming up, the potential solutions to stop outbreaks behind bars. Anyone who is confined in close quarters with other people is at high risk, and that includes prisoners and corrections officers. There are already confirmed cases in facilities in Canada, and as Ross Lord explains, advocacy groups say unless Canada's most vulnerable inmates are removed from institutions, the consequences could be deadly.
At this time of shifting lifestyles, another surprising move could be in the works: releasing prison inmates during the pandemic.
We think there's really only one way to prevent the spread of the virus, and that is to release as many prisoners as possible into safe and supported housing in the community.
Advocates say it should start with offenders who are elderly, nonviolent, or with medical conditions that leave them especially vulnerable. They say otherwise, COVID-19 could kill large clusters of inmates. A former inmate of this women's prison in Nova Scotia says fending off contagion is impossible.
The common areas are too small to be practicing physical or social distancing. They share bathrooms, they share the kitchens, they share the common areas.
Some inmates have been granted a temporary absence, mostly those who were serving sentences on weekends at provincial jails like this one. But the federal government has resisted calls to release nonviolent prisoners from federal institutions. Ottawa says Public Safety Minister Bill Blair is checking to determine whether there are measures that could be taken to facilitate early release for certain offenders. Correctional Service Canada says it's preventing the spread of COVID-19 through measures like suspending visits to inmates. But in several institutions, infection is taking hold, including Port Cartier, Quebec, where some inmates and staff have tested positive, and the Grand Valley Institution for Women in Ontario, which is reporting an infected inmate. Some provincial jails, including the Saskatoon Correctional Centre, have several infected staff members.
Should it happen, the likelihood of it spreading wildly across the population is very high.
The Correctional Officers Union says the answer is changing routines within institutions, not releasing inmates. No easy answer for another pandemic predicament. Ross Lord, Global News, Dartmouth, Nova Scotia.
Still ahead, comparing the pandemic paths of Canada and the United States. Many in the U.S. now realize political leaders there have not acted fast enough. New cases have quickly outpaced some of the world's hardest hit countries, including South Korea, which reported its first case on the same day as the United States. America has been slow to test and slow to order people to stay home. Political leaders are fighting over precious medical supplies now. That's a sharp contrast to the Team Canada approach here. It's not perfect here either. We have shortages too, and people are dying here too. But as Eric Sorensen explains, we're in a better position than our neighbors to the south.
Closing the border may prove to be a blessing for this country.
The virus.
For weeks, the U.S. president downplayed the risk.
By April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
Even when Donald Trump acknowledged the seriousness of COVID-19, many state governments held off stay-at-home policies. New York Times analysis of cell phone data tracked Americans' travel last week. In New York State, virtually none. In many states, still lots of travel. From devastated New York came this warning.
Look at us today. See yourself tomorrow.
In Florida, where so many Canadians spent time in March, beaches for a while still teemed with people. They eventually closed, though the governor only issued a statewide stay-home order on April the 1st.
See, people thought Easter, all that. That's not going to happen.
In Canada, the crisis struck and governments of different stripes mobilized together.
Stay at home.
Stay in your homes.
All levels of government, including mayors, got on the same page.
Every single one of us. Stay home.
And the streets here largely emptied. Canada and the U.S. were on different paths. Through the middle of March, the number of cases in the United States was outpacing the number of cases in Canada at about 10 to 1. That makes sense in terms of population. But by the end of the month, Canada had moved up into the low thousands. The United States had skyrocketed from there. The U.S. now outpacing the number of cases in Canada by 22 to 1. A full-blown crisis is now underway south of the border.
I hope we can do this by Easter.
It didn't help Americans weighing the seriousness to see the White House forecasting an early end that its own experts would not predict.
Obviously, no one is going to want to tone down things when you see what's going on in a place like New York City.
I'll have Dr. Strang answer that.
In Canada, political leaders have consistently deferred to specialists.
I'll see if Dr. Tam has an additional comment.
The medical experts have become the voice of Canada's pandemic policy.
Medical masks, respirators must be preserved for health workers.
The federal government and the provincial governments really were key in scaling up preparations for this infection earlier on compared to the United States.
Canadians are not out of the woods, but we can also feel for our American neighbors and the sheer scale of the catastrophe they now confront. Eric Sorensen, Global News, Toronto.
Next, survivors offer first-hand advice for your COVID-19 concerns. For more than a month, Global News has been working to find answers to your questions about COVID-19. And one that keeps coming up is what it's like to actually have the virus. Our Jeff Semple has been speaking directly to Canadian patients to find out. Jeff.
Well, Donna, for the past few weeks, we've been taking viewer questions straight to the experts. But this time round, we're asking a group with first-hand knowledge of what COVID-19 can do.
I'm feeling like a bird that's been out of the nest.
Karen Shoemaker has never felt so excited to be in her kitchen.
There's my steel-cut oatmeal that I'm cooking for myself for breakfast for the first time in a long time.
She's just completed 3 weeks of quarantine, one of the first people in BC to be diagnosed.
I was in that right age group to be really dangerous.
One viewer named Wayne wrote in to ask, do the symptoms of COVID-19 include a loss of taste or smell? Shoemaker says that was actually one of her first symptoms.
I couldn't taste coffee, so I would say, don't bother making a pot. I can't taste it.
Deb wrote in to say, I understand most people are only experiencing mild symptoms. Can you please elaborate on what mild means? Kyla Lee's COVID-19 is considered mild, but it sure doesn't feel that way.
To be plagued with a fever for 2 weeks, a cough for over 2 weeks, shortness of breath at even the most basic activities, that's not fun. And for that to go on for a long period of time when you're completely alone is scary.
Kirsten wrote in to ask, should younger people with underlying health conditions such as asthma be self-isolating and not going into work? Emilio Merritt thinks so. He suffers from asthma, and COVID-19 landed him in hospital.
The way that you cannot breathe is totally different, because the asthma, when I get the asthma, is more like a wheezing, like that's more like when the asthma thing, and this one is more like you cannot get air inside.
And Terry wrote in to ask, could you please provide a real description of the devastating symptoms individuals are suffering? Erin Lee is just 38. She's been in hospital for a week.
Really, that's the big thing, is just not being able to catch my breath.
Lee has an underlying medical condition, but no recent travel history.
So as far as we know, it's community transmission.
Lee and all of the patients we spoke with also have a message for the viewers. They say, please keep your distance, and if you can, stay home. Donna?
Can't say that often enough. Jeff Semple in Toronto, thanks. That is Global National for this Thursday. I'm Donna Friesen. We leave you tonight with some lockdown masterpieces. This modern Mona Lisa is part of a new art collection inspired by a call from the Getty Museum. Art lovers around the world were asked to recreate famous works using only what they have at home. Some pretty creative ones. Thanks for watching. Take care of yourselves. Bye-bye.